Hi, everybody. I'm Dr. David Kingsley, and I'm a trichologist. I'm also president of the World Trichology Society, and I want to explain a little bit about what trichology is and some of the things that we do, and maybe you might be interested in becoming a trichologist yourself. So let's start, and I will bring up the presentation. So bear with me because it always takes me a few minutes. Okay, so this is just legal stuff. And these are some ways that you can interact with the World Trichology Society and even contact us at info@worldtrichologysociety.org or call us at this number. And a little bit about myself, my credentials, and my memberships. Okay, so the definition of trichology. What is trichology? Well, it is the study of hair loss and associated scalp problems. It bridges the gap between cosmetology and dermatology. And trichologists, we take a naturopathic approach. And what I mean by that is that we spend time with our patients or clients discussing lifestyle influences on their hair. For instance, things like diet and stress and how they wash and dry their hair. And I'm going to be going into that a little bit more in just a few moments. We also need to do a critical analysis. Now, what is a critical analysis? Okay, so you have a client who is coming in because they have a hair loss issue, and you need to work out why they're losing their hair. You need to also be able to differentiate between what condition it is and what condition it isn't. And then, of course, you need to recommend treatments. And that's what trichologists do in the initial consultation. So one of the things that you learn during the trichology course is to differentiate between different types of hair loss. There are many different types of hair loss. People think it's just sort of like genetic hair loss and that's it. But it isn't. There are temporary hair loss. There's hair loss that will regrow. There's hair loss that won't regrow. And there's hair loss that will regrow a little. So you need to be able to tell the difference between which one. So these are just examples, difference between male pattern hair loss and telogen effluvium, alopecia areata, cicatricial. Okay, what are these? Well, I'll show you in a second. And then traction and trichotillomania. So male pattern, genetic hair loss. The pattern is on the crown or the vertex, and it gradually thins. The hair goes from what we call terminal, thicker hair here, into what we call miniaturized or smaller, finer hair here. And what's the difference between that and telogen effluvium? Well, telogen effluvium is more what we call diffuse hair loss, meaning it's coming out from all over the scalp, whereas with the genetic hair loss, it usually is coming out in this frontal and crown areas. So that's one way to tell the difference between the two. Of course, there are others, but this is just a sort of a basic intro, isn't it? And then alopecia areata, the patchy hair loss. I mean, this is a little bit more advanced because there's a lot of the patches here you see have actually joined together to make one big patch. But the difference between that and what we call cicatricial or scarring alopecia, this is scarring alopecia. And, they look fairly similar, right? But there are many differences. The positioning, that in scarring, the hair follicle has been dyed, if you like. It no longer exists. Whereas in alopecia areata, you would still see hair follicles. Also, if you look microscopically here, you would see what we call exclamation point or exclamation mark hairs, which you don't see here. Here you see what we call island hairs, meaning that they're scarring and then all of a sudden up pops one or two little individual hairs in an island. And this is usually, depending on how far it's gone, how much hair loss and for how long, this usually regrows. This usually doesn't regrow because it's scarred and the follicles have died. Then we're going to tell the difference between hair breakage, which is traction, and trichotillomania, which is where you pull your hair out. And usually with traction, it's hairdressing, you brush it, you chemically perm it or whatever, straighten it, and you damage it basically, or you're too hot a hair dryer or something like that, and you break it quite often around what we call the peripheral or the outside of the hair. Hair pulling, you usually actually put your hand on your head and actually either twist the hair or pull it out, and that's called trichotillomania, and usually that's from the dominant hand. Both are temporary. Both you can regrow. However, it depends how long they have been going on for, because if you've damaged the follicle, those follicles aren't going to regrow. And also, you learn about the cosmetic side of it. Damaged hair. This is dull hair. If you think of a hair shaft, this is a hair shaft, but I know it looks like slates on a roof, doesn't it? And they lie flat. So if it's nice and shiny hair, they will lie flat and light will reflect off it. And you say, oh, I've got shiny hair. But once you start getting product build up and maybe a little bit of the outside, which is the cuticle of the hair lifting up, of course, light can't reflect off it properly. So it becomes a little duller. And this is where it's even more damaged, the outside of the hair, the cuticle. And of course, this would be very dull, but also because if you have a hair next door with a similar type of cuticle, those cuticle cells, which are these, will get locked together and then you get tangles. And then you're sort of using a comb or a brush and you're pulling the hair out and you're breaking it. And then you get your traction alopecia and so on and so forth. What else would you see? You might even see a hair knot. Now, you wouldn't see it like this. This is like 200 or 500 times the size or something. So, you're not really going to see it like this, but that's what it looks like. When your hair's knotted, that's what it looks like. And sometimes the cuticle, the outside layer, is broken up and it exposed the cortex, which is the inner part of the hair. What other things could you see? Split ends. Most people have split ends, particularly if it's slightly longer hair, right? Because their hair is older down here. Your hair grows about ½ an inch a month, which is about 1.2 centimeters a month. So, you can judge how old your hair is by how long it is. And the longer it is, the more it's been through, the more chemical processes, the more drying, the more just general pollution in the air, etc. And the ends begin to split. Can you cure them? No, you cannot. You might see all these commercials saying, I can cure a split end. No, they can't. They might be able to smooth it back down, but it's not protecting it really, and it's not curing it. So why call it a split end when you could call it trichoptilosis? I mean, come on now. Doesn't trichoptilosis sound better? Oh, I have trichoptilosis. Oh, what's that? Split ends. And another one is where the hair shaft is weak. You're combing, you're brushing your hair, and it snaps off. And you think, oh, it snapped off. What do I do? Why? Well, that's because the cuticle has been, and the cortex have been damaged, and then it just snaps easily. And it's like two brooms put together, and that's what it looks like. So those are some of the exciting things you see as a trichologist, and some of you who are in the field may have already seen most of those. And now you're thinking, well, now I know what it looks like. How do I know what causes it? Well, I can tell you. And I can tell you by the 7 H's of hair loss. And the 7 H's are the 7 causes or the main causes of all types of hair loss conditions. Now, don't get me wrong, not all hair loss has all 7 causes. Some types of hair loss, just one is causing it. Some types of hair loss, maybe 2, 3, 4, or 5 are causing it. But the skill of you as a trichologist is to find out what they are. You're like a detective. You've got to go in there and you've got to say, oh, I can see there's hair loss. Now we've got to find out what the culprit is or who the culprit is of your hair loss. And that's what we're going to do with the 7H's. So I'm going to ask you some questions and I'm going to write it down. And then I'm going to find out what it is and what it isn't. And the 7H's, hereditary. And we're going to go through these, so don't worry. Health, hormones, hassle or stress, healing or medicines, hunger or diet, and hairdressing. So we're just going to go through it quite, briefly because I just want to get you excited as I am about this science of trichology. So heredity, well, it's genetics. Well, hey, look, I've got genetic hair loss, but my parents don't have any hair loss. My grandparents and uncles, aunts, and nobody in my family has hair loss. How can I have genetic hair loss? Well, it's not hereditary hair loss, but it is still genetic. It means that your genes, which are different from everybody else in your family, have come together and made you more susceptible to genetic hair loss. Remember, you're not a clone of your parents, and I'm sure most of you are actually quite pleased about that. So because you're not a clone, you're not going to be exactly like them or your grandparents or your brothers or sisters or aunts and uncles. You're going to be you. So it can be genetic, but not hereditary. Polygenic means many different genes. So there could be hundreds of genes involved with genetic hair loss. Now, in the past, and some of you might have heard this, that, oh, it's your mother's father that's the culprit. If your mother's father is losing his hair, then, that's the guy. The poor guy's being blamed needlessly. I mean, he's just sitting there smoking his pipe and everybody's blaming him for the hair loss. And it's not really to do with him, because what happens is that boys tend to follow the male line, like their fathers and grandfathers, and daughters tend to follow the mothers, like the mother and the grandmother. Not exact science, but that tends to be what happens. So leave grandpa alone, all right? And it depends on the family hair type. So if somebody has hair loss in your family and it's the same color hair as you and it's the same texture as you, then you're more likely to get the genetic or be more susceptible. And also, the more people in your family with genetic hair loss, the more likely you are to get it. But again, remember what I said. None of them have it. It doesn't preclude you from having genetic hair loss. And then DHT. I'm not really going to go into that, but dihydrotestosterone. I mean, that's a big word, and it's a hormone, and it's what really drives genetic hair loss. And it's a susceptibility to it. But in women, there are other types of enzymes and hormones and stuff that might be relevant here as well. So, it's important to know, but You'll learn more about it if you take our courses. Then we got the hormones and, like thyroid, diabetes, too much testosterone. Like I was saying with the dihydrotestosterone, it's similar, but just a different form. Um, Pregnancy is a hormonal event that may affect the hair cycle. You have a baby and your hair starts falling out, 3 months later or whatever. And it's normal and it usually grows back. And that's a form of telogen effluvium. You know how we discussed that earlier. A lot of women, some women get cystic ovarian problems where there's some cysts, benign cysts on their ovaries. Sometimes that can lead to hair loss going on. OCP is the oral contraceptive pill going on, coming off. And at menopause as well, women can lose their hair. General health will affect the hair. If you have anesthesia, if you have an operation, usually, by the way, you know how I said the hair takes a few, grows about a half inch or 1.2 centimeters a month? Well, usually, not every hair loss condition, but most hair loss conditions, it actually takes a while for the hair to fall out after it's stopped growing. So what do I mean by that? Okay, you combed your hair this morning and it fell out this morning. If you think about it, the cause of it actually occurred on average 3 months before. So if, say, it is, I don't know, let's say it's March. It isn't March, but if it was March, you'd go back to like December, January as the cause of the hair loss, because that's when the trigger occurs. And this makes it very difficult when you're doing treatments because, you go and have a treatment, you go to your trichologist, and the trichologist is doing some great treatments on you. And it didn't stop the hair loss immediately. And it wouldn't. It would take time. It took time for it to fall out. It would take time for it to not fall out, unfortunately. But, it's not all or nothing. You'll find in stages it will begin to get better. So anesthesia, sometimes that can cause hair loss 3 months later. And sometimes it could be why did you have the anesthesia? Well, you had an operation. It could be that as well that's triggering the hair loss. Having a fever sometimes can cause hair loss. COVID can cause hair loss, again, a few months later. Autoimmune conditions can cause hair loss, such as that scarring type of alopecia and such as the alopecia areata. They're autoimmune. I put here smoking. Of course, none of you smoke, but if you did, could that be a factor? Maybe a little bit. Could be. Some studies have indicated that there is a correlation, but cause and effect, but it's not good for you anyway, isn't it? Healing medicine. This is a toughie because, you can go on a medicine and your friend could go on the same medicine and you get hair loss and your friend doesn't get hair loss. It's an individual reaction to the medicine. You could be using a medicine for a while. It causes hair loss at first. It doesn't after a while when you get used to it. Or sometimes it didn't cause hair loss at first, and then you start noticing hair loss after you've been on the medicine for a while. It's many. Or is it the reason why you're taking the medicines that's causing the hair loss? For instance, with thyroid medicine, people say the thyroid medicine is causing the hair loss. Well, could it be just the thyroid not functioning properly itself that's causing it? And taking the medicine might actually be helping, though not fully, but partially. This is best worked out of when did you start the medicine, when did you stop the medicine, and then do that 3-month thing where, it was 3 months ago, maybe it is the medicine. Obviously, chemo does affect the hair cycle as well, temporarily, but it is very emotionally disturbing. Obviously, the cancer is as well, but so can be the hair loss. Stress. Oh gosh, we're all under stress. So, everybody should be losing their hair. No, it's just a susceptibility of stress. Um, you have day-to-day stress, but sometimes you have like stress episodes where it's like crazy stress for a while. And, psychological or physiological, maybe you broke a arm or a leg or something like that. And it will affect or can affect the hair cycle, usually temporarily, because once everything is either healed or you're now doing your meditation and you're doing your exercise and you're doing your relaxation, it will begin to get better. And neuropeptides is just nerve proteins that are produced when you're under stress that can sometimes trigger a hair loss event. Remember, a few months later, usually speaking. And then diet. One of the main causes of hair loss, believe it or not, in women is iron deficiency. It's not meaning that they're anemic. It just means that they're slightly low in iron. Also, a diet, losing weight rapidly, losing like 8 kilos, 15 pounds, 16 pounds in a month. Sometimes that can affect the hair cycle because your metabolism's changing. And if your metabolism's changing, then the hair cycle may be disturbed. You also need enough protein. The hair's made out of protein, and your hair is a non-essential tissue, which means it's not important for the functioning of the body. It's important for the functioning of your mind. I can understand that. But if you're not eating well, the hair is one of the last things to get it or the first things that cut back. You need protein, fish, chicken, meat, eggs, tofu, beans, legumes, carbs. You also need carbs. All right, you don't need to eat your potatoes and bad carbs, the breads and things like that. You can have good carbs, the fruits and the vegetables. They're broken down and they make energy. And energy, there's 3 letters for energy, ATP. That's the energy in our bodies. Carbs help produce that. You'll learn all about that when you're a trichologist. Also, eating frequently. The best diet for your hair is like what they call grazing, 4 or 5 meals a day, little bits every few hours. That helps keep your metabolism constant. And there are other vitamins and minerals as well that can affect the hair cycle. And you'll learn about that with the courses. And then there's hairdressing. Well, you've been to the hairdresser, or even if you do it yourself, you're over blow drying it, you're brushing it, you're over processing it. You're getting traction alopecia or hair breakage. And that is a type of hair loss. It might not be hair loss from the root, but it's hair loss, and it's something that is reversible and something that you can do, that you can help by not doing what you're doing and just trying to dry your hair with maybe a slightly cooler temperature. Test the temperature of the dryer with your hand. If it hurts your hand, it's going to burn your hair because your hair's no nerves in it. So you're burning it without realizing it. But if you put it next to your hand, ouch, too hot. Put it next to your hand, okay, not too bad. That's fine. And that's how you would dry your hair. Is it going to take a bit longer? Yeah, it might take a few minutes longer. Also, I would tend to comb it to detangle and brush to style. If you brush it to detangle, yeah, it will detangle, but it pull all the hair out as well. So just be a little bit more careful. So hopefully I've whetted your appetite a little bit about becoming a trichologist, or at least learning a bit more. And we have a course called Fundamentals of Trichology. It's a diploma. You get a diploma, you hang it on your wall. Hey, I'm a fundamentalist. I'm a Fundamentals of Trichology diploma. Online course. Perfect for people who don't necessarily want to become certified trichologists, but want to learn more about hair loss and scalp conditions. And we didn't even talk about that, the scalp conditions and dandruff and seborrheic dermatitis and things like that. And it's great for cosmetologists, hairdressers, healthcare professionals. But we also have a full certification course, which again is all online. I mean, you do it from your home. And this is if you want to practice it, concentrates on clinical trichology, meaning what you do in your trichology center and how you deal with your clients or patients and how you analyze them. Remember, we've been talking about the how you analyze them, how you find out why they're losing their hair, what type of condition it is, and then what type of treatment. We didn't talk anything about treatment. That's something we'll talk about in the courses. And our certification course is licensed by Florida State Education Department. So we have a very robust course, an excellent course that's actually been licensed by a state in the United States. And therefore, it is a course that you can rely on. We have affordable payment schedules. We also have continuing education, meaning, okay, I'm a certified trichologist. Yeah, but you still need to keep learning because things change. Whatever industry you are in now, if you think back to when you became what you do now and the amount of knowledge that you have now from when you started, it's vastly different. Why? Because you needed to keep up to date, and you need to keep up to date with being trichologists. So we help you do that. We have webinars, we have newsletters. In fact, we have weekly live educational webinars. So you can watch them live or you can watch them on delay. And they cover all aspects for you. In the courses, there are videos as well. It's not just written literature. It's a video for each part of the course as well. And sometimes many different videos for different parts as well. So that helps you understand everything better. And of course, you can always email me personally or somebody at the World Trichology Society, and we're always there to help you. And or you can call or whatever. It's going to be, it's a great career. And it also, for those of you in cosmetology and you're thinking, I don't know if I want to do that, it will help give you another form of getting more people in, another stream of to help with your business. And so it is very good to help grow your business by helping your clients. And if you have more choices in your business for your clients to do, okay, they're coming in, maybe they're doing a color, but maybe they need some trichology. Maybe they need some strengthening for their hair. Maybe they have a hair loss issue. Yeah. So it is an added income stream for you. And I personally oversee the courses. And again, if you have any questions or you want more information, go to our website or email us at info@worldtrichologysociety.org. You can see us on Facebook, you can see us on X, which was formerly Twitter, or you can call us. And we are here to help you become a trichologist. So thank you for listening. I am going now to unshare. So thank you for listening, and I hope to hear from you soon. And take care. Bye for now.